Hi, I'm Seanda.
And I'm Daisy, the mental health captain.
And we're back to talk about another topic for mental and behavioral health, right?
Right.
And we just, again, want to remind you that we are not experts, and we're just here to do our part to try to normalize the conversations about mental illness, mental health, behavioral health, and see if we can decrease the stigma. Because the more we can talk about it, the more maybe we'll feel better, as well as be more comfortable asking for help if we need it, right?
Right.
And we're just here to see what we can accomplish along those lines, right?
Right.
So, in that vein, what should we talk about next, Miss Daisy?
Depression.
Depression's a good one. And I know that one myself. And it's no fun. And we need to see if we can help each other with that one maybe a little, right?
Right.
So why should we talk about depression?
Many people struggle and suffer from it.
Right. A lot of people struggle with it. A lot of people suffer with it. And so we want to see what we can do to decrease it. Loneliness and suicide can be associated with depression. And so we want to do our part to try to help that, right?
Right.
So let's just talk about the definition first. So what is depression?
A mood disorder.
Yep, it's a mood disorder. And there may be persistent sadness or a loss of interest in life. And if it affects our daily activities, that's definitely the part of the disorder. Disorder is not a bad word, but it just means it just might need some more attention. And we might need to do something about it because it's a health issue, not a judgment. It's about health. And so if it's interfering with daily life, we might need some help with it, right?
Right.
So let's talk about symptoms, and I'll let you start.
Okay. Feelings of sadness, tearfulness, emptiness, or hopelessness.
Yeah. Sometimes you might feel worthless or empty or sad, and that can be depression. You might have changes in your sleep patterns. You might want to sleep all the time, or you might not want to sleep at all, or have trouble sleeping. You might have some insomnia, but sometimes it's kind of hard to get out of bed when you're depressed because you just don't have the energy, and you may just feel really sluggish, kind of like a human sloth, that you just don't have the energy for anything, and it seems like everything takes so much out of you, right?
Right.
You might be slow when you're thinking, right?
Right. Or thinking.
Right. You might speak slowly, move slowly, just feel like everything just seems to weigh on you, right?
Right.
What else?
Anxiety.
Yeah, you might have anxiety or agitation, irritability. You might get irritated really easily over really small things. And you just might have physical problems that you can't figure out why your back hurts all the time, or things just don't feel right. And it actually could be depression rather than a physical problem, like a medical problem kind of thing, right?
Right.
What else?
Trouble concentrating.
Yeah, you might have trouble thinking, concentrating, remembering things. Yeah, you might, and you might even have bad thoughts, right?
Right, like suicide.
Yeah, like if you're kind of focused on death, and you're still thinking about not wanting to be here anymore, and that is definitely something we want to do something about, because we all matter, and we all need to feel like we matter, right?
Right.
Yeah. So those could be some things that if you're losing interest in things that you normally like to do, sports and hobbies and stuff like that, those also can be symptoms of depression. Yeah. So let's talk about the causes of depression, okay? Okay. And I'll start with biological issues. Yeah, that's the changes in what? Your brain. Yeah, changes in your brain. And so that could be biology. It could also be brain chemistry. Yeah. Changes in the function and effect of neurotransmitters. Yeah, those chemicals that help transmit nerve impulses and messages in your brain, neurotransmitters. If there's a change in how messages are passed in your brain, it can affect your mood ultimately, right? Right. Yeah. Hormones can affect your mood. And of course, hormones are those chemicals that are produced in your body, and commonly pregnancy and menstruation and menopause, those can be chemical hormone changes times in your body. Yeah. And what else? Inherited traits. Yeah. And there's a genetic component, it's thought, too, that depression can have. So those could be some of the causes for depression, right? Now we can talk about complications, things that are correlated with depression, things that might be affected by or that might affect depression, okay? Okay. So first one we could talk about would have to do with weight. Excessive weight or obesity sometimes can accompany depression. Yeah. Or pain. Yeah, pain or physical illness, those can be correlated with depression. There's also alcohol and drugs sometimes can be affected by or affect depression. Yeah. Or anxiety, panic disorder, social phobia, things like that. Family conflict. Yeah, family conflict, relationship difficulties, school problems. Those are some things that can affect or be affected by depression. Social isolation. Yep, social isolation. Suicidal ideation also can affect or be affected by depression. Self-harm. Yeah, self-harm, also another one. So now we can talk about types of depression. Okay. And let's start with clinical depression, or another title that is referred to as major depressive disorder. Yeah. And that's feeling sad, low, or worthless most days for at least 2 weeks, while you're also having other symptoms like sleep problems or a loss of interest of activities or a change in your appetite, right? Right. What's another type of depression? Persistent depressive disorder. Yep. Persistent depressive disorder. And that's a mild or a moderate depression. And that lasts for at least 2 years. It's less severe, the symptoms are, than the major depressive disorder. And previously it was called what? Dysthymia, right. And so that's 2 of types of disorders. What's a third? Disruptive mood dysregulation disorder. Wow, that's a mouthful. Tell me about it. And that's disruptive mood dysregulation disorder causes chronic, intense irritability and frequent anger outbursts. And that one's associated with kids, with young people, adolescents. Okay, how about premenstrual dysphoric disorder? That's premenstrual syndrome, symptoms like bloating and fatigue, usually around the time of a menstrual period, and it affects mood symptoms. You might be irritable, extreme irritability, depression, things like that. So what's another type of depressive disorder? depressive disorder due to another medical condition. Yep. And that's when there's a change in the body that leads to depression. And some examples we could probably give, like what? Heart disease. Yep, heart disease, cancer, Parkinson's disease, hypothyroidism. Any chronic illness can be associated with it and be relative to that. How about atypical depression? Yeah, that's major depressive disorder with atypical features, or that's the other way of saying it. And the main difference with that and major depressive disorder is that there's a temporary mood improvement in the response to positive events. So there's mood reactivity. And other key symptoms might be increased appetite and rejection sensitivity, right? Right. Okay, so what's another depressive disorder?
Seasonal affective disorder.
Seasonal affective disorder, which is also referred to as seasonal depression. And that's a form of major depressive disorder. And it typically happens around fall and winter seasons and disappears around spring and summer seasons, right? Right. And you might see also increased appetite and rejection sensitivity with that, right? Right. Okay. And so the last depressive disorder or type of depression that we're going to talk about would be prenatal and postpartum depression. Prenatal is during pregnancy, and postpartum is within 4 weeks of the baby being born, of delivery. So those are several common types of depression, right? Right. Next, let's discuss how to tell if we have depression. What can we do?
Talk to someone.
Yeah, talking to someone can be an easy-ish way of getting some confirmation. If you're confused and not as to whether you have it or not, you can always talk to a professional person like a doctor or a therapist or a counselor, or if that's not who you're ready to talk to just yet, maybe a family member or a friend. Someone that you can trust, that you know has your best interest at heart, and they'll give you honest feedback and might be able to help you determine whether or not you have a real problem. And just as a side note, talking to a doctor, sharing symptoms with the doctor, you might have a physical issue, and that might be something that they would identify. So it might not be a mental or a mood disorder, but it might. So those are ways to find out, right? Right. Next, let's talk about managing and treating depression.
Okay.
And what's one type of treatment?
Psychotherapy.
Psychotherapy or talk therapy. And an example of that would be maybe cognitive behavioral therapy or CBT, right?
Right.
And there's also what else for treatment?
Medications.
Medications like antidepressants. Another treatment might be complementary medicine, things that are used in conjunction with Western medicine like acupuncture or massage or hypnosis or biofeedback, right?
Right.
And there's what else?
Brain stimulation.
Brain stimulation therapy, right? And that's for more severe depression or depression with psychosis. And examples might be electroconvulsive therapy or ECT. And that's when you pass mild electric current through the brain. There's transcranial magnetic stimulation or TMS. And that's when you use a magnetic coil to influence the brain's natural electrical activity. And there's also vagus nerve stimulation or VNS. and that's when the vagus nerve is stimulated, and it alters the activity of the nerves, right? Right. Okay. So my favorite personal management, what could we talk about? What are our favorite things to do to help ourselves? Go outside, connect to other people, and volunteer. Right. Go outside, connect to other people, and volunteer. Like on our pins that we like to wear, remind us to do those kind of things, because when you go outside, you get some fresh air. When you connect to others, you get to talk out some problems and be around people that might understand kind of how you're feeling and where you're coming from. And when you volunteer, you get out of your own head and you get to help other people, and which helps us too, right? Right. What's another thing? Exercise. Yeah. Exercising not only helps our bodies, but helps our minds. And plus, when our bodies feel better, our minds sometimes follow, hopefully always follow, that we feel better. So exercise is really important, even if it's just stretching. You don't have to do a high impact to benefit. You just need to move. And if you do it outside, even better, right? Right. Okay, what else? Healthy diet. Eat healthy-ish. So again, trying to keep your body healthy makes you feel better, and your mind will feel better too, right? Right. And sleep is another one, to get quality sleep. We talked about with depression, sometimes you can sleep too much or not enough. So if you can get good sleep, quality sleep in a quiet atmosphere, dark, the best kind of sleep, that's the best for helping you feel better, right? Right. If possible. You can also manage stress with mindfulness techniques like meditation, or like relaxation activities like yoga. Yep, like yoga. And you might want to kind of be careful with depressants, alcohol and some drugs, because they can complicate things with depression, right? Right. And what else? Make time for fun. Make time for fun. We way underestimate fun, don't we? Yeah. Yeah. Fun can help our brains get a break, and we need fun. We really do. We really need fun sometimes, if at all possible, right? Right. And last but not least, treat yourself like you would treat someone you really cared about, because sometimes we don't treat ourselves well enough, and we sometimes can be our worst enemies, and we really need to be kinder to ourselves sometimes, and be helpful and loving to our bodies. And if we can help ourselves, it'll make us feel better too, because we need to be on our own best, on our own side. And that's not to say you're a bad person or anything, but it just makes you feel better if you can be your best friend and your biggest supporter. So we want to support everybody, and we want to support each other, right? And we hope that you have less depression out there, and that we all feel better, right? And we all heal each other and help each other. Thanks.